Hello, and welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and one of the owners of Ascend Health Center. And I'm here with Dr. Mcelrath. How are you today?
I'm good. How are you?
I'm good. So she owns Monarch Ideal Care, and last time we were on the show, I actually got on one knee and asked you to be my primary care physician.
Yes.
Which I wanted to repeat that, but it's probably disingenuous since we just had our second appointment and came here for the show and all that.
Yeah.
Because it was the first time I'd been to the doctor for an embarrassing amount of time. So.
Yes. But you're doing better now.
Everything works, yes.
There we go.
I had both my kidneys. It's a great time.
It's really a whole situation. Yeah, love it.
So I actually had some questions to ask you, but I did see something this morning, I think it was in the New York Times, where it said that life expectancy has plummeted over the last few years in the U.S. Like they even had a graph and it went like this, which obviously means plummet. But,
yeah.
And it wasn't even for 2021, it was for the few years before that. So we can't blame all of COVID for it. Mm-hmm. And they said maybe it's because people are lonelier, there's not as much to live for, we're not as connected to our communities, churches, things of that nature. So as a primary care doctor, I was just curious what your take was on all that sort of thing.
I kind of agree. I used to tell people all the time, like I grew up in the wrong generation. My sister's generation, who's only 10 years older than me, they knew their coworkers, they hung out with their cousins, they had this really tight sense of family, which we don't have anymore. And without that, you do feel like, well, why am I here? What is my purpose? And it used to be family, it used to be church, it used to be something greater than you. And as we've become more woke, we've kind of lost that sense of we're here for a reason and we're trying to find that reason. And the uncomfortable truth is maybe we're not here for a reason, and that causes people to not have as much fulfillment in life and want to do the things necessary to live the best life that they possibly can. So I kind of agree, and it's sad, but...
No, that makes sense. And that's a little bit of how your practice works, because you are sort of a physician from a generation ago, because you actually see your patients and have relationships with them. It's not the whole come to our clinic, see whatever provider we have, and get out the door and take your scripts with you.
No. So I do I'm trying to build a community around myself, where, when I have to take vacation, like my patients are excited for me to take vacation, or if I ever have a kid or get married, like everybody's involved in this because they know me and I know them personally. And, it's not just a situation of, I stubbed my toe and I'm just going to go talk to my doc. It's, hey, my kidney's hurt, but how are you doing? And, these other things. And this just, exciting thing happened in my family. And I want to be a part of all of that.
Right. No, that makes sense, because that is much different than today's culture, where it is sort of, okay, I know what my friends' kids look like because I've seen them on Facebook.
Right.
Don't really know what their names are.
Don't know who they are. It's like, oh, I didn't even realize she was pregnant. I just had that phenomenon happen earlier today where I was like, didn't even know she was pregnant. She's got another baby, and her kid is really big now. Wow. Right. When did that happen? Yeah.
No, exactly. I had one friend who purposely refused to have any social media so that if I wanted to talk to him, I had to pick up the phone and call him and have a conversation.
Yeah, I'm like that. Like, my birthday isn't on Facebook anymore, because if you know my birthday, then you will reach out to me. Otherwise, you don't really know me and you don't really care. Like, that's how I see it.
And I got pranked once because all these people wished me a happy birthday on April 27th. I was like, that's not my birthday. I thought these people knew this. It isn't my birthday. How could you think that my birthday is? It's September 1st. For anyone who wants to know.
We're going to write that down.
September 1st.
Write that down.
Right. So back to the primary care. Again, normally today healthcare is this cookie cutter. Come in, let's bill what we can, and then get out of our office.
Right.
So why doesn't that work? Like, you think we're doing all the things, it's the best research that leads to this is a pill you need or this is a treatment that you need.
Because the way I think of it is we wouldn't have made it to 2021 if we needed all of these things. We've only had all of this technology in the last 50 odd years or so. And it's good and it's useful and it's extending our life, of course, and our lives are better than it was, 50 years ago, 100 years ago. But we wouldn't have made it as a species if it wasn't just about the things that you eat, the connections that you have, the water that you drink. and kind of getting back to that and getting back to prevention as opposed to, oh, I need to see a cardiologist because I have hypertension. Well, you don't. A good primary care doctor can take care of that. And it's cheaper and it's faster, and it's a person that you actually know, that actually cares about you and looks at you as a whole person. And really good specialists try to look at the whole person, but we are ever more being segmented. It's the cardiologist for, arrhythmias, and that's the one that you see. If you have an arrhythmia, you can't just see the regular cardiologist anymore. You have to go to the special specialist.
Right.
And yeah, they have the latest technology, but a surgeon wants to cut, so they're always going to encourage that. Where as generalists, we tend to be, okay, well, let's watch, let's wait, let's see what happens, give me more information. Let's sit down and actually talk about what your symptoms are, and see if we can figure it out together, rather than let's order this gamut of tests.
No, that makes sense. And it's changed so rapidly, too. I remember in 2004, I was a brand new nurse in the cardiothoracic ICU at Cleveland Clinic, and we'd get out our calipers and look at the P wave and interpret EKGs. And now, 17 years later, as a nurse anesthetist who's had a lot more advanced knowledge on everything electrophysiological, I would look at it like, that's strange. Well, send them to the cardiologist.
Yeah.
And that's kind of my responsibility, that even though I'm technically much more of an expert, the way the culture is like, let's send this to the person who knows this the most.
Yeah, and sometimes it's the nature of the facility that you're in where they are encouraged to send you to specialists, the primary care doctors. But sometimes it's also just the time that you have allotted for a particular patient. If you wait until the last minute, doc's grabbing the doorknob and, oh, by the way, I've had chest pain. Okay, let's send you to the cardiologist because I literally just don't have the time right now. And that's part of the reason why I built my practice the way I did, so that I can make sure that I do have the time to listen to those questions and sit there and kind of piece everything out and decide, do you really need to go to the cardiologist, or can I order these tests myself and interpret them myself?
Right. So I was going to ask, how does a patient tell? Like, when do they think they're just wanting to bill me for more things and send me to all these doctors in their network? But I think you answered it. Like, if you have a relationship with your physician and you can trust them, then you actually don't have to figure it out.
Right. You don't have
they say.
Exactly. Like, there's at no time that myself or any of the people that I truly consider colleagues are just going to order an unnecessary test. It's about what's best for the patient. And I sometimes, especially with new patients, have to tell them, I need a little blind trust. Like, right now you don't know me. You don't know that you can trust me, but I need a little blind trust that I'm doing the right thing for you. I'm recommending the right thing for you, so that we can figure out what's going on in the most cost-effective, timely manner. And sometimes that is sending you to a specialist, and sometimes it's doing it ourselves.
No, that makes sense, because it's hard to tell. I think, not me because of who I am as a person, but most people would think, well, let me get the MRI. I want the CT scan. Let's get X-rays. Let's make sure of all the things.
Oh gosh, yes, I would love a full body PET scan. That's not the best thing for me, and that's the reason that the both of us went to school for as long as we did, to have the knowledge to know what is the best thing at the right time for a patient. Not just, we're just going to order everything, because somebody has to pay for that everything.
Right.
Even if you have Medicaid, somebody is paying for that everything. And if we're doing things in a cost-effective way, it's not always do all the tests. Sometimes it's just, hey, tell me the whole story.
Right. Well, it's probably the philosophy of it too. Obviously I'm asking all these questions too about community and loneliness, because at Ascend it is more mental health. And okay, is it that you're severely depressed and you need this medication, or do you need friends and someone to talk to beyond the therapist? Because that's extremely helpful, but sometimes there is that concept of, well, they're listening to me, but I'm also paying them to listen to me. So sometimes there's no substitute for a social support system.
Yeah. Now, whenever I have, so I do free meet and greets, because I feel like you should have an opportunity to meet your doctor before you start telling them all of your medical stuff, because maybe we don't have a connection. Maybe you don't feel comfortable with me, and now you're have a bill that you have to pay me, and you didn't even like me. So
if you're like, hello, and I'm like, so I have this rash. It's
yes,
like, whoa.
Let's talk about some other things. And so I do this meet and greet.
Let's start with the weather already.
It's like, gosh. But one of the last questions that I ask people is, who is your person? Who is that one you go to for encouragement, for celebration, to commiserate with? Who is that person? Because I want to make sure that everyone has a person, you know, and that can be your mom, your sister, your best friend, but everybody needs that person.
Right. We should change our forms, at a sense, from emergency contact to who's your person?
Who's your person?
I like
exactly. Because that's the person that you know, when scary things are happening, that's the person that you call. You know, it's not necessarily, maybe it's not your husband. Maybe it's your best friend that you've known since you were 6. That's the person that needs to be there with you when you're getting a cancer diagnosis.
Right.
You know, and that's the whole idea of having that community and having your doctor be a part of that community. Because I tell patients, let me tell you when to be scared. Because I will tell you when it's time to be scared. Until then, don't stress. Just do the steps that I recommend, and we will figure this out together.
Right. So it sounds like transparency in healthcare always helps too, because you know, because I talked to a patient today about sending her for an MRI because we've tried a few things and we're still not sure what's going on, and so it's like, I don't know, why don't we try an MRI? Well, other times it's like, no, I've got this. Here's 4 things that we can try for your depression, or look, I know your chronic pain didn't work well with the ketamine infusion, but here's another option. So that does make a lot of sense.
Yeah,
so.
and having the humility to say, well, I don't know, let's delve further into this, I think is really comforting to a lot of patients. I don't pretend that I know everything, because I don't. The person that knows the most about your body is you. And I am here, and I went to school for a very long time to give you options based upon the things that you tell me. But if you don't feel comfortable with me, you don't feel like you can be open and honest about the symptoms that you're having, then I can't actually help.
Right. Then it's more like you're a veterinarian. And,
yes,
well,
which is why I'm not a pediatrician. Pediatrics, veterinary medicine, they're all the same thing. They're very cute, but they can't tell you anything. Yeah, so.
Oh, that's great. But with back to the CT and the MRI, and the patient wants all the things, like how much is too much? Because that's our culture too. Like, we need to biohack and take all the supplements and drink all the water and wear all the masks and eat all the right food and exercise.
It's hard to say. And I think the way I usually do it is when a patient asks me, well, should I try this new supplement that I read about this? Sure, try it. Your body will tell you if that's the right thing for you, because that's only if you're willing to listen to your body, because it tells you, hey, I don't like this food. And that sometimes is with an upset stomach, but sometimes it's with a rash that just came out of nowhere.
Right.
You know, or sometimes it's with emotions, like, why am I depressed every time I eat chocolate? That's weird. That shouldn't happen. Well, maybe your body isn't processing it appropriately. If you're willing to listen to your body when you're trying new things, I'm all for my patients trying out different things, because the research isn't always there. And research isn't everything. It's a lot. Don't get me wrong. It is a lot. It's very important. But research isn't everything. Sometimes trial and error is necessary. But for like CTs and things like that, it's all about the information that you provide to the doctor. You know, given the information, and I tell patients all the time, this is what I think we're going to do now, but if something changes, I need to know that, because that may change what I think we should do.
Right.
You know, don't just assume, oh, well, the doctor said it was fine, and then your foot falls off. I told you to come back if your foot got worse.
Right.
You know, I've had patients do that, where they're just like, oh, well, you said it was fine, and it turned black, and I thought, well, she said it was fine. It's like, no, come back and talk to me. Like, let's keep talking, keep putting the pieces together, because that is what's going to get us the picture to figure things out.
Right.
And also understanding for patients, we are not mind readers. And like, it sickens me whenever a patient comes in and it's like, well, why does this hurt? And I'm just like, I don't know. You've not told me anything. Like, I don't know why that hurts. Give me some information.
Right.
Give
You're
me
like,
a little
let
background.
me get my magic school bus.
Exactly. Just like, I'm just gonna figure this out. Like, I'm a mentalist now. No, it doesn't work that way. And sometimes we just don't know why things happen. You know, and that's okay, because bodies are weird.
Right. Well, it sounds too that you have to be willing to listen to yourself, even if it goes against your health philosophies. Like, you know, I say at Ascend we do holistic care, but that doesn't mean, oh, you don't need that Prozac. Just take the St. John's wort and you'll be fine. it means, look, we might have to go supplements or yoga or medications or TMS and ketamine and all of the...
Well, and I think that's the thing about holistic medicine, true holistic medicine, is that we're doing all the different modalities. We're using Western, we're using Eastern, we're using new stuff, we're using old stuff. We're trying to figure out what is the best for you.
Right. So if someone might take all these kale smoothies and say, I actually feel worse, it's like, well, maybe the phytic acid is doing something wrong, or someone else might say, no, I feel really good and my body's detoxifying. Because we also know there's studies where people feel better depending on what they think they're doing. So,
The placebo effect is real. It's serious.
And it's a lot cheaper and fewer side effects than a lot of medications too.
It's very true. That's very true. Hey, that's where the blind faith sometimes comes in. I've had patients where I had one patient, he came in, and for years he had been complaining about this numbness and tingling in his legs, and no doctor would listen to him about it because all they cared about was his diabetes, where his blood sugars were in the 200s and 300s and his A1Cs was 12, and he wasn't taking his meds. He was very non-compliant, and I went in and I listened to him. And I let him talk about his leg pain and everything that was going on. And I was like, okay, well, this is what I want you to do. I want you to take this B complex vitamin, has to have this much B6 in it. I wrote it all down for him and sent him on his way. Now, my boss, because I was newly out of residency, my boss was like, oh my God, why didn't you change his meds, his diabetes meds? And I'm like, because he didn't want to talk about his diabetes. He wanted to talk about his legs. So I talked about his legs, and he's gone now, so whatever. Patient comes back 2 or 3 weeks later, and he's like, yeah, doc, my legs feel better now. I was like, oh, so you did the thing? No. So why do your legs feel better? I don't know, but they feel better now. So what do you want to talk about now? Well, hey, let's talk about your diabetes.
Right.
And by the time I left that job, he was distraught that I was leaving because he's like, well, how am I going to keep control of my diabetes? I was like, I didn't do anything. You did it.
Right.
Just keep taking your meds, but because I was willing to listen to him and meet him where he was and address the problem that was important to him, he never did anything about the numbness and tingling in his legs, but it went away. And then he was able to focus and trust me when I told him, hey, we need to adjust this medication for your diabetes. We need to talk to you about eating better. We need to do these things. He was willing to trust me because I was willing to listen to him.
And he still did the work, meaning that he still talked about, this is what's bothering me, instead of, well, I guess we should only address the thing that's most important.
Yeah.
Because obviously with my clinic, where it's pain and psychiatry and all that intermingled, we see that all the time, where a patient will come in with depression and PTSD and chronic pain. And usually if we just take care of one of them, the rest will fade. So
because it's all connected.
Like pick one.
Right, it's all connected, and it's like, what's the most important thing to you? Whenever I talk to a patient about going to counseling, the first thing they're just, oh my God, no, counseling, no, I can't do that. And I'm just like, sometimes talking about it, just talking about what's going on, will help fix the things that your body is manifesting because you're hiding from that mental health thing.
Right.
And it will figure itself out. Like that's legit conversion syndrome. That is a legitimate thing that happens to people. But you got to get them to trust you. Right.
And that is one of the things I like most about your practice, that I get 2 free counseling. Well, I guess it's technically not free, but
not free. Right, you're paid for it. Right. Yes, it's built in. And I built my practice that way. So with the base program, which I'm actually about to change it so that it's only the base program again. You get access to me as a primary care doc, in office and telehealth visits. You get 2 sessions with the mental health counselor every month, and you get a massage every quarter. Built in, it's use it or don't use it. Right. I don't really care, but it's available to you because I felt through my own personal experiences that mental health counseling and massage therapy is just so integral to your own physical health. Right. If you deal with some of those things, you won't necessarily need to go talk to your doctor. Yeah. Your body will figure itself out on its own when you're dealing with your mental and you're dealing with relaxation and stress and things of that sort. And
that's also why, like today at our appointment, is only the second time I came to you in a year. After my massage, since one of the problems was my fingers, since I'm klutzy when I play basketball and I play sports so poorly. I was like, well, let the massage therapist work at it, and then I'll see you right after. And by the time I got to you, like, all 3 issues weren't that big of a deal, but because I already made the appointment, we could address it in case I was wrong and it was a big deal.
Exactly.
Because as you know, those of us in healthcare, it's kind of challenging to have us as patients.
We are the worst patients
Right.
ever.
So it was like,
Yeah.
I think I know exactly what's going on, but I could be wrong.
I could be wrong,
And
yes.
since I made the appointment, let me follow through. And I think that's what you were saying too, that if you can access healthcare easily and affordably, or at least know exactly what you're paying, then when the problem's small, you'll go instead of having to come see me in my role as a nurse anesthetist, where we bill $500, $600 every 15 minutes.
Yeah.
That's a very expensive way if you just don't see your doctor and discuss
just
something.
Prevent things instead of waiting until they get terrible. I think that was one of the things when I was in training that I just it would drive me up a wall. Like it's 2:00 in the morning and a person's coming in with something that's been going on all day. All day this has been a problem.
Right.
But at 2:00 in the morning when I'm tired, you want to come into the hospital, and it's just like, why didn't you do this with your primary care doctor during the day when everybody was fresh and it wasn't as big of a deal?
Right.
You waited until I'm about to die and now I'm going to go to the ER. It's like, well, if you came when your belly was just hurting, we could have possibly prevented you from having to have emergency surgery.
Right.
Things of that sort. And like you said, when cost is transparent, when you know exactly how much it's going to be, when you know that you can get in easily and quickly, you don't have to wait until the very last minute to get things figured out. I tell my patients all the time, don't wait until the last minute. I'm not doing anything else.
Right.
Message me, go on the portal, ask me a question. That's what I'm here for.
Right. Especially for our complex patients, it's the same way. Don't go to the ER. We'll get you in. Obviously, if it's a serious condition, someday you just have to go. But
if you think you're having a heart attack, don't come see me. If you broke a bone, I can't really do much about that. But if it's oh, my belly hurts, or oh, I haven't pooped in a week, I can probably deal with that.
Right.
If you wait, maybe you have diverticulitis and it ruptures, and it's let's prevent that.
But that's also where some of your functional medicine training comes in, where you can look at labs more precisely of, okay, actually, this is what's going on, or maybe it appears normal, but let's head this out before we see the symptoms, meaning that it's an advanced disease. So.
Yeah, I mean, a lot of what the lab considers normal sometimes isn't optimal. And so understanding a little bit better about how to read the labs and having other labs to offer, because certain things that primary care truly is terrible at dealing with, fatigue, weight gain, female hormone issues, depression, and there's 5 and I always forget one. I think it's just never, and I always switch them up too. So I always forget one. I can't remember what the last one is. It'll come.
But you are right, because we have a lot of patients with fatigue and depression.
Yeah, and my answer as a primary care doctor using your insurance is take some B complex vitamins and take a nap. And sometimes that's true. We forget that sleep is an active part of your body's cycle. You have to sleep, you have to rest. And when we're trying to go 24 hours a day, bodies don't like that.
Right.
But having this functional medicine and being able to kind of pinpoint, oh, your adrenals are fatigued, and that is why you're constantly exhausted. And with these particular supplements, we can ramp those back up. And with you changing your diet, these things will fix themselves. Sure. And we can get you better. And it's not just here, take a pill every day for the rest of your life.
And I think it circles back to what we first started talking about, that when you have a community around you, you don't feel, oh, I need to be 100% get all the tests because it's only me. You just fit into your community and you want to take care of yourself so you can provide value to others. And it makes a lot more sense than either the one extreme where you just don't take care of yourself.
Right, don't do anything. I smoke, I drink, and then I turn 60 and it's like, why am I broken?
Right, or the other extreme where it's like, well, you have an appointment tomorrow. You had one last week. There's nothing crucial going on here. You just have to trust us. So.
Yeah.
Right. So how can patients contact you if they're interested? Because obviously I'm a testimonial myself. I think you're great. That's why we're both here today.
Thank you. So my website is Monarch Ideal Care. So it's Monarch like the butterfly, MONARCH, Ideal, IDEAL, care.com. And on the bottom of every page, there is a link to schedule a free meet and greet. We can do that either telehealth, through Zoom, or in person. I actually like it better when it's in person. But it's 15 minutes of us just kind of sitting down, talking about you and talking about the practice. The website is very robust. I worked on it myself. So it has lots of information about my philosophy on medicine. So check that out and see if that fits with you. and I'm always looking for new subscription patients. So that that package that I told you about earlier costs $85 a month. So no matter if you see me 5 times that month, 1 time that month, or no times that month, it is still the same price. Because the whole idea is there will be times when you don't actually need me, but you'll utilize massage therapy or you utilize the counselor. And then sometimes you'll pop in and say, hey, I need something, or not pop in. We don't do walk-ins.
Don't you pop in on us.
Don't do that. I'm not there. But you know, when you'll have to pop online and say, hey, this is what's going on, you know, do I need to come in? Because not everything actually needs an in-person visit. Sometimes we can do things online, and that saves you from having to leave work. And so, yeah, monarchidealcare.com, schedule a free meet and greet. I would love to meet you.
Sounds great. And for our clinic, again, psychiatry, pain management, non-opioid, of course. We do a lot with substance abuse as well, and it's just ascendhealthcenter.com or 754-4484. And a lot of times we also have these complex patients that have tried, a lot of doctors have tried everything for anxiety, depression, OCD, fibromyalgia, migraines. That's sort of our specialty as well. But it's the same approach. We're honest with you. We'll let you know, oh, we can really help you with this, or actually you should probably go see Dr. Mcelrath or whatever it is, because I think today with how complex patients are, we certainly need everyone on board and a lot of collaboration.
It is a team approach. Very, very true. It is a team approach.
Definitely. Well, thanks for joining us for this episode of the Ascend Health Show, and we'll see you next time.
Bye.
You are watching WCTV, Wadsworth Community Television.